This is Haiti Merritt with Insulin Nation. We are here at the Joslin Diabetes Innovation Summit in Arlington, Virginia. A lot of words. This is Andy Weber, and you are with the, you're going to have to correct me, National Business Association.
I'm president and CEO of the National Business Coalition on Health.
Thank you.
Coalition on Health. Yes.
Thank you for joining us.
Yeah, sure.
Now, what is your greatest aspiration in combining healthcare and technology?
In simple terms, changing behavior. At the end of the day, both patients and providers, I think, need to fundamentally change their behavior, their decisions, so we can get to better health and healthcare.
Yeah.
And I think technology is a great catalyst to make that happen. You think of just, some of the technology that could be reminder systems for both patients who need to be adherent to their treatment regimen and are getting behind if they got some smart signals from their mobile apps and you haven't taken your medication today.
Right.
And the same thing for a physician that could have a electronic medical record that could really track patients over time and remind them when the patient does come in the sorts of issues and decisions they need to make together. It's a wonderful tool.
It's true. Now I've sort of morphed that question because it has occurred to me that the technology and the advancement of it is actually not broadening, but kind of narrowing who we're helping, because not everyone is that tech savvy. Do you feel like we're leaving out a bunch of people now?
Well, I think there are a couple answers to that question. Yes, we need a very broad global approach.
Right.
And yes, there are going to be populations that will not have access to technology, and we've got to make sure that they're not left out of the intervention and innovation strategies that are out there. At the same time, you take advantage of the wonderful tool.
Yeah. And
more people, even people of modest means, are taking advantage of technology these days.
Right.
The price is coming down, the mobile apps. So I think it's going to be pretty widespread, even with vulnerable populations.
I think you're probably right about that.
Let's hope so.
Yeah. Now the catchphrase for this conference is "be considered part of the solution." What does that mean to you?
Well, I represent the employer business community, and we believe we are part of the solution. We believe that it's the health and productivity of our workforce that gives us a competitive edge. So we want to do everything in our power to make sure that our people are healthy and well and motivated and are not sick and absent from work. And then secondly, we pay for healthcare services. We provide health insurance benefits to 170 million Americans. Those costs have been going up.
Yeah.
They hurt our bottom line. They lead to the fact that we can't give wage increases to our workforce because we're spending so much money on healthcare. So we believe, as a purchaser of healthcare services, we've got to be part of the solution. We have to be a catalyst for change. We have to be a voice to say the healthcare delivery system needs to change, and change fundamentally. So it's focused more on prevention and trying to get to health outcomes, rather than just be a system that all the money goes to the treatment of illness when it's too late.
Right. Now,
so we want to be part of that voice.
Right. The sort of the attitude here that's new to me, at least, is that teamwork is taking place of competition as the primary motivator. Do you think that that is going to work? Do you think people coming together is going to be, more productive than the competition? Everyone is kind of.
I'm all for collaboration, but we can't be Pollyannish about this either.
Right.
I believe that some of the collaboration and cooperation that we needs to be motivated by the underlying financial incentives in the system. If the financial incentives, for example, reward management of chronic disease, reward population health improvement, reward integration of care, then you will have providers, I think, working together more than being in their own little silos working on, again, treatment of illness.
Right.
So if we, again, I would say to get to collaboration and cooperation, we can't forget the financial incentives in the system that will reward that sort of behavior.
Right.
And we need to get there.
The last planned question is to put these cards in order. We have technology and patient healthcare, patient-provider relationship and interaction, and community-based healthcare solutions. Which do you think is most important and least?
I can't mush them all together.
You can be as creative as you want.
They're all very important, but I start with community-based healthcare solutions.
Okay.
My public health friends have told me, and I think appropriately so, if our goal is to improve the health status of the American population, it's really not about healthcare and healthcare delivery. It's about community and its influence. It's about the family. It's about schools. It's about people having jobs. It's about the environment and whether kids can walk to school and whether we have bike paths and recreation.
So
and
it's really treating the person.
Right. So community-based health solutions, if I can modify this term a little bit,
there are no rules here.
Is where we need. And
this
again,
is a non-judgment
right,
zone.
that's right. And again, it's those determinants of health that are more important than the health care delivery system.
I agree.
So, you know, I think of my daughter here who's 13 years old. I think technology is really going to play a catalyst role. It has become so widespread, as we talked about. It can have such, I think, a positive influence. So I would put that sort of neck and neck with the last one, patient-provider relationship and interaction.
Right.
I mean, patient-provider, that's always been the heart and soul of the healthcare delivery system. But I think technology, information is going to inform that interaction. And I think patients, rather than providers, are going to be a key element of deciding on the healthcare solution for individuals, rather than sort of our old culture of providers imposing healthcare solutions on individual patients. There will be a real dialogue and a coming together in the future. That's my hope.
That's great, fascinating stuff. Thank you for joining us on 5 Spot. We have the wild card question. What is your worst habit? Period. What is your worst habit? Something you could break if you could. Too much coffee, you know, I don't know. My worst habit, says my wife. That's what I was hoping for. I didn't want to go there, but that's what I count on that. Is that I watch too much sports. I'm sure this is very typical, but I grew up in New York City. I love the Yankees and the New York Knicks. Cut. Right. No, that's great. That's good. And I follow sports a lot. All right, good. Well, thank you very much. And thanks for joining us. Okay.